We're a newer program, which has kind of allowed us to look at what has worked at other fellowship programs, what hasn't worked, and kind of develop our own style, if you will. The collaboration of Children's being a freestanding institution with a very well recognized and respected academic center, UNMC, it really allows the combination where really anything that the fellow wants to do or accomplish, he or she will be able to do that.
Between our ICU here at Children's Hospital Medical Center and our ICU at the Nebraska Medical Center, we cover all the different aspects of care, including solid organ transplants, ECMO, you name it, and we have all that available.
One of the unique things that we are offering is that their first rotation that they start off with is not going to be in the ICU. We actually have them rotate with about 10 different services, and they will spend a day or two with our nurses, charge nurses, respiratory therapists, our pharmacists, our dietitians, OT, PT, speech language pathology, child life, social work, as well as case management. Our purpose in doing that is that I think in order to be an excellent physician, you have to have a appreciation and understanding of what other people do in the ICU to help these kids. None of what we do can be done without everyone else's involvement.
I think another good, important part of our program, unlike in many places where pediatric ICU is separate from the cardiac ICU, not only separate physically, but also the faculty are totally in different divisions. But our program is that all the faculty are in one division. They are all committed to making sure that the fellows get the best education and have the fellowship program very successful. We learn from everyone. We are now up to 19 faculty members and continuing to recruit. We have a growing research footprint in our division and also within the department. The goal is to continue to increase the research output within the division. And we've had several faculty members, junior and senior both, who have been involved with research, clinical research, basic science research, translational research, everything. All those opportunities are there, both within the Children's Hospital and also at the university system.
We have purposely staggered our research months every 3 months, and that'll be consistent throughout the 3 years. Our hope in that is that we can engage fellows earlier on their scholarly project and really develop it within the first 18 months and then be able to finish it by the time they're third year. This will allow them to work together, to collaborate. It will give all the fellows a little bit of time where there's not as much clinical obligations.
We are very lucky indeed to be part of the Child Health Research Institute, and that has really fostered a lot of research in all aspects. Our productivity within the division of research just in the last few years has increased tremendously, and we will continue to contribute whatever way we can. Simulation is another thing. It can be both educational but also has tremendous potential to increase the research, and simulations is now really extremely important in any aspect of clinical medicine. You know, UNMC, we have had the IXL Center, or the Davis Global Center, which has tremendous capabilities and facilities available for simulation.
In addition to kind of the traditional curriculum, we are going to be doing, a kind of focus on the diversity, equity, and inclusion. We're going to do something a little bit different than some fellowships. In addition to not only the academics, we're going to have like a book club here that specifically focus on aspects of medicine.
The important aspect of our program, of our division, has been people are really happy to be here, and that says a lot. ICUs can be very busy and stressful, as you can imagine, but what makes it very good is that we all know that there is help. I came here over 20 years ago. Came from big city. I grew up in Mumbai in India, and Omaha grows on you. Any aspect that you might have interest in, there are things to do, both indoors, outdoors, cultural, sports, everything. It's a great place to work and great place to live.
We can teach what it takes from a skill standpoint and a knowledge standpoint. But I think the most important thing for the fellow To be successful is to have a high degree of integrity, communicate very well, and have a hard work ethic. By the end of the program, we want them to be not only just competent critical care physicians, we want them to be clinically proficient, meaning that they are able to clinically excel in any environment that they'll be placed in.